Hello, and welcome to our Lunch and Learn webinar series. Today's topic, how chronic pain affects employee absenteeism and what you can do about it, is brought to you today with the support of our sponsor, the University of Fredericton. My name is Tanya Seneschal, and I'm the event manager at the Fredericton Chamber of Commerce. Our presenter today is Brent Harlack of the Medicine Shop Brookside. Brent has been a licensed pharmacist for over 16 years within various pharmacy practice settings, such as community pharmacy, clinical hospital pharmacy, and the pharmaceutical industry. In addition to his pharmacy education, Brent also holds a master's degree in physical chemistry and is a certified diabetes educator. Brent is currently employed with the Medicine Shop Pharmacy as a compounding pharmacist, where he provides customized therapeutic medication specializing in pain management, hormone imbalance, and geriatric care. Brent is also a certified pharmacist immunizer and can prescribe for minor ailments. Ladies and gentlemen, please welcome Brent.
Thank you, Tanya, for that introduction. I also would like to thank the Chamber for inviting me to speak today as part of their webinar series. Also want to welcome members who are listening and watching today. And finally, I'd like to thank the University of Fredericton for this wonderful venue. As a pharmacist, the majority of talks that I do are health-related, and usually they're for patient groups and or other healthcare professionals. So I've never had to present to a business-focused audience. So my goal today was to present a topic for the members that overlapped the two disciplines of healthcare and in business. Now, in our pharmacy, we see a lot of patients struggling with chronic pain. We see a lot of patients being treated for chronic pain. So we thought that a great presentation for the members would be to look at workplace employee absenteeism and how it's affected by chronic pain. I first want to start with a quote from Buddha, no less. The quote is, "Pain is inevitable, suffering is optional." Recently, there's been an increased recognition of pain management as a fundamental human right. There is an increasing recognition that chronic pain is a multifaceted disorder associated with considerable disability, tremendous burden to the patient, strains on our healthcare system, and on society overall. Pain is taking also a toll on the economy and debilitating productivity in the Canadian workplace. Chronic pain presents tremendous challenges for people who are also trying to build and maintain a career. So it's a costly situation that will only get worse if workers continue to suffer and are not treated appropriately for their pain. Just want to spend a little bit of time on some Canadian absenteeism trends. Despite reports of the multi-billion-dollar impact of employee absenteeism on the Canadian economy, employers may be unaware of the extent and the causes of absence issues within their own companies. Absenteeism contributes to a substantial amount of lost productivity and revenue for Canadian companies and the Canadian as a whole. According to a Stats Canada survey from 2011, the average absenteeism rate across all regions, sectors, and types of employment was 9.3 days per full-time employee. And it presents itself in many forms, ranging from the casual day off to longer-term leaves. Interestingly, the survey from Stats Canada indicated that New Brunswick actually has the second highest provincial absenteeism rate at 11 days, second to Saskatchewan. Now, there is an abundance of Canadian data available on the main reasons behind short and long-term disabilities claims. However, it can be difficult to pinpoint the causes of casual or intermittent absences because the majority of employers do not track this type of information. In 2012, a study by the Murnau-Sheppel Group surveyed employers and employees to gain a better understanding of the underlying factors that predict absenteeism. And what they found was that only 46% of Canadian companies actually tracked employee absences. The same survey illustrated that few companies track the direct costs of absenteeism. In 2012, only 15% of companies track this type of data. Now, the direct cost of absenteeism is the salary cost associated with the number of workdays lost. So for 2012, companies estimated that the direct cost of absenteeism averaged 2.4% of gross annual payroll. Now, while 2.4% may seem like a fairly insignificant amount, if one considers that the total wages for Canadian employees was $692 billion in 2012, this translates to a loss of $16.6 billion to the Canadian economy. Sorry. Now, the indirect costs are harder to quantify, and these would include things like the replacement costs for absent workers, so finding and training new workers, the administrative costs, so the time spent finding a replacement worker, a reduction in employee morale as more employees may need to take on increased workload, reduction in productivity due to delays or missed deadlines, and if an employee is absent, then basically the productivity for that employee is zero. And also a reduction in customer satisfaction. So when these additional costs are considered, the cost of absenteeism to companies becomes substantially higher. Just want to spend some time on the absentee rates by employee characteristics. Now, as workers age, they tend to miss more days of work. And this is influenced by illness and disability and not so much by personal or family reasons. Those aged 20 to 24 miss on average 5.9 days, compared with 13.2 days for those aged 55 to 64. And the incidence of physical chronic disease increases with age, which of course contributes to the increased illness and disability among this group. Another study published by the Journal of Health Economics from Norwegian data looked at some different employee characteristics to determine whether they have an effect on absenteeism. And the researchers found that employees with higher levels of education and higher salaries tend to be absent less. And the study also found that absenteeism rises with the number of hours worked. Now, there are various drivers or reasons for workplace absenteeism. Of course, the biggest one would be personal illness. So this would include employees who need to take time off for a cold or a flu. Family emergencies, which can be hard to predict, would include things like a death in the family or maybe a wonderful life event such as the birth of a child. Canadian employees are not only caring for young children in a lot of cases, but are also looking after elderly parents. So child and elder care issues are also reasons for workplace absenteeism. So this can include staying home with a sick child or having to take an elderly parent to a doctor's appointment. Stress, burnout, disengagement, or workplace conflict can also be another reason for workplace absenteeism. Acute injuries can force people to stay home, such as a broken leg or another acute injury. And the last point we have here is chronic pain, which of course is the focus of our presentation today. Now, in 2008, a survey by Nanos Research looked at employed adult Canadians, and they found that 18% of adult workers experience chronic pain. And the results of the study indicate that pain may be crippling Canadian workplace productivity by significantly increasing employee absenteeism. The survey reports that the chronic pain suffered by Canadian workers is often undertreated and causes those workers to lose an average of 28.5 workdays per year. Out of the chronic pain sufferers polled, the survey also found that 60% had lost their job, experienced a loss of income, or had their workplace responsibilities reduced as a result of their pain. So in addition to absenteeism, another phenomenon for patients who do experience chronic pain is presenteeism, which is being physically present at work but unable to perform at full capacity. And the problem is, even when chronic pain sufferers are at work, they're often not fully productive because their pain makes it hard for them to focus on their work, or they have physical limitations that prevent them from performing certain roles that would normally be part of their job description. This is a slide, again, from the NANOS Research Survey. So this, I pulled some of the data from the survey, and I just want to draw the members' attention to the last 3 points. From the survey, those who were polled who do suffer from chronic pain indicated that their average income drop was almost $13,000. $23 billion was mentioned as the annual lost wages by those who have become unemployed because of chronic pain. And $14.7 billion was the annual lost productivity cost as a result of employees having to take time off because of their chronic pain. Chronic pain also presents tremendous challenges for people who are trying to build and maintain a career. And perhaps the biggest challenge for workers with chronic pain is actually hanging on to their jobs. They are often let go because they call in sick more frequently. And people with chronic pain experience more disability days, more time spent in hospital, and more frequent doctor visits than those who do not experience chronic pain. And even when they do hang on, sufferers often find their career stalled as managers stop sending important projects their way, or the workers gain a reputation for being unreliable. Some workers prefer to hide their pain from bosses or coworkers. They may be afraid that they're going to be stigmatized and seen as a liability rather than an asset. And some people just don't like talking about their health issues at work because they see it as a personal matter. A great quote that I came across when preparing this presentation was from an employer who said that absenteeism does not make the heart grow fonder among coworkers, as some coworkers may not be aware of the issues or the problems that chronic pain presents. It's not surprising that many people with chronic pain, close to 30% according to the NANOS research, also become depressed or experience other mental health problems. Workers with chronic pain report having a lower health-related quality of life than employees suffering from other health conditions. And employees often feel guilty, frustrated, and even like they're a burden, and it can have negative effects on their mental health and their morale. So it's clear that chronic pain is taking a toll on the Canadian economy. And although chronic pain is undertreated, the Canadian healthcare costs associated with its current treatment are estimated at more than $6 billion per year and are expected to skyrocket in the future. This costly situation will only worsen if workers are not appropriately treated for their pain in a timely manner. And there is a substantial proportion of Canadian adults who live with chronic pain that is long-standing and severe. I just want to shift gears for a little bit and talk a little bit about pain and chronic pain, just to get a fuller understanding of the issue that we're talking about today. Now, due to it being a complex subjective phenomenon, defining pain has always been a challenge within the medical community. Pain, of course, is a distressing feeling often caused by an intense or damaging stimuli. And in medical diagnosis, pain is regarded as a symptom of an underlying condition. The definition of pain that is most widely accepted within the medical community is the one put forth by the International Association for the Study of Pain, which is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. Pain is an unpleasant sensation that can range from mild localized discomfort to complete agony. And pain is often crowned with suffering. And because of this, pain interferes with quality of life and general functioning and has physical and emotional components. Pain is the most common reason for doctor visits, mainly because it's a major symptom in many medical conditions, ranging from arthritis and back pain to diabetes and shingles. And the word pain itself comes from the Latin word pona, meaning a fine or a penalty. And certainly those who experience pain often feel that they are being penalized since there is such a strong emotional component to pain. So what are the different types of pain? So we have acute pain and chronic pain. So very quickly, acute pain usually comes on suddenly and is caused by a specific injury or event to soft tissue. Acute pain is sharp and severe in quality. Acute pain usually does not last longer than 3 months and is usually treatable or self-limiting, meaning that it goes away when there's no longer an underlying cause for the pain. Causes of acute pain would include things like surgery, broken bones, dental work, or burns or cuts. Chronic pain is the pain that is ongoing and usually lasts longer than 3 months. This type of pain can continue even after the injury or illness that caused it has healed or gone away. And in this case, pain signals remain active in the nervous system for weeks, months, and sometimes even years. Examples of chronic pain include arthritis, cancer, nerve pain, back pain, and fibromyalgia pain. There are physical, psychological, and social components to chronic pain. People who have chronic pain have physical effects that are stressful on the body, and these include tense muscles, limited ability to move around, a lack of energy, and appetite changes. Emotional effects of chronic pain include depression, anger, anxiety, and fear of re-injury. And such a fear might limit a person's ability to return to their regular work or their leisure activities. Chronic pain may occur in a variety of locations in the body and for many different reasons. And some people suffer chronic pain even when there is no past injury or apparent body damage. So what are the different types of chronic pain? So chronic pain usually falls into one of 2 categories. Nociceptive pain is caused by inflammation or damage to body tissue and is usually described as a sharp, aching, or throbbing pain. This type of pain is caused by inflamed or damaged tissue activating specialized pain sensors. When activated by stimuli, the pain sensors notify the brain about the injury with electrical signals sent via the peripheral and the central nervous system. When the brain receives these signals, it has perception of pain that's being felt. Neuropathic pain occurs when there is actual nerve damage or a malfunction of the nervous system. Nerves connect the spinal cord to the rest of the body and allow the brain to communicate with the skin, muscles, and internal organs. People often describe this type of pain as a burning or heavy sensation or a numbness along the path of the affected nerve. This is a busy slide, but I more or less just want to show or illustrate some of the examples of chronic pain. So for neuropathic pain, we see a lot of the neuralgias and the neuropathies, which makes sense because patients do describe this type of pain as burning, numbing, or tingling. Examples of nociceptive pain are things like osteoarthritis, joint pain, limb pain after a fracture, or post-op visceral pain. And of course, as we mentioned, patients describe this pain as being very, very, very sharp and throbbing. There is an area of mixed pain, which is pain which has both neuropathic and nociceptive components. And the most common examples that people would be familiar with would be cancer pain and carpal tunnel syndrome. I'm not going to spend too much time on this slide, but I just wanted to draw the members' attention to the last 2 points in both columns. And it talks about how the different types of chronic pain respond to traditional pharmacological therapy. So we see that nociceptive pain tends to respond well or very well to traditional pharmacological therapy, whereas neuropathic pain does not respond as well to traditional therapy. And in a few more slides, we will be looking at some of the common oral medications for pain therapy. but also look at some novel and unique customized therapeutic options for patients who are experiencing chronic pain. So how common is chronic pain? The prevalence of chronic pain for adults is roughly 20%, or 1 in 5 adults, or 1 in 5 employees. And this is a value that has been seen in many surveys and in many studies. Chronic pain prevalence is usually greater in older adults, and females have a higher prevalence at older ages compared with males. In the study that I cite on this slide, they indicated that approximately 1/2 of those with chronic pain reported suffering for more than 10 years, and approximately 1/3 of those reporting chronic pain rated the intensity in the very severe range. The lower back was the most common site of chronic pain, and arthritis was the most frequently named cause of chronic pain. So obviously, the prevalence and severity of chronic pain is also associated with greater use of healthcare services. And this ties into employee absenteeism, since people with severe chronic pain will require more doctor visits and will require more days off. To use the iceberg analogy, with chronic pain, like an iceberg, only the tip is visible, but underneath the surface is an enormous load. And it is the load that one carries when living with pain that is oftentimes indescribable. So with chronic pain, there exists what we see and what we don't see. And what we don't see are things like anxiety, depression, fatigue, numbness, soreness, sleeplessness, mood changes, reduced stamina, and all of these things can affect workers' performance in the workplace. So what does an employee with chronic pain look like? Employees may not present with any of the classic signs of pain. They may not look like they're sick. They may not look like they're in pain. They may not wince. They may not put their palm on the small of their back. They may not complain about pain. They may be sleep deprived, and they will have difficulty concentrating at work because of their chronic pain. Another great quote I came across in preparation for this presentation is, you don't send flowers to someone in chronic pain, a lot of times because you aren't aware. So even though these pain patients may not look like they are in pain, they are most certainly likely trying to treat it. And when it comes to treating chronic pain, medications play a crucial role. There are numerous medications available to help manage pain. However, every pain patient is different and responds to medications differently. The medications that we are most familiar with would be the over-the-counter medications, such as Tylenol, and the non-steroidal anti-inflammatories, such as aspirin, Advil, Aleve, or naproxen. These drugs are very commonly used, but may not be strong enough. And the majority of chronic pain patients may need prescription medications to cope with pain, or may need to add their anti-inflammatories in addition to other pain medications. This is a slide with some American data, but I want to just use it just to illustrate some of the other classes of medications that are used to treat chronic pain in addition to anti-inflammatories and Tylenol. Of course, narcotics are at the top of the list, but also antidepressants are used to treat chronic pain at doses that are much lower than the doses that are used to treat depression, simply because they are able to manipulate the levels of certain hormones that are in the body. Muscle relaxants are also used in addition to benzodiazepines and neuromodulators like gabapentin. So what are the goals of chronic pain therapy for those who are suffering? it's unrealistic to cast no pain as a treatment goal for chronic pain management. When possible, pain should be prevented and controlled to a degree that facilitates function and quality of life. Pain management and goals also must be tailored to the needs, desires, and circumstances of individual patients. So the goal of therapy is to make the pain tolerable. So we want to reduce pain, we want to increase ability to function so that employees can get back to work and stay at work. We want to improve sleep, we want to reduce stress, and also restore quality of life. Analgesic pain medication can mean the difference between bearable and unbearable pain. And chronic pain may be difficult to treat, so the solution for therapy may also involve some trial and error. And while it may be frustrating to try different prescriptions, it may be a needed exercise to find the right one to control the pain. It also may be required to explore alternative treatments or other modalities. Used alone or combined with medications, alternative treatments can be a powerful tool in learning to live with chronic pain. And these would include things like massage therapy, physiotherapy, chiropractic care, and exercise and stretching. Now, traditional oral pain medication can be effective, but they are certainly not risk-free or side effect-free. Common side effects of anti-inflammatories can be nausea and vomiting, but also stomach pain or heartburn. Common side effects of narcotics can be sedation, drowsiness, and constipation. Other meds might cause dry mouth or appetite changes. And oral medications can also have negative effects on the liver and kidney, especially if they're used long term. So for patients or employees suffering with chronic pain and looking to explore how to treat it, it certainly can be a balancing act as they must balance pain relief against acceptable side effects. And for some patients, the side effects may be just as intolerable or untreatable as the pain itself. Some sufferers of chronic pain are fearful that if they are taking narcotic medications for chronic pain, that means that they're addicted. And this is certainly a question that we get asked a lot in the pharmacy. And what I tell them is that taking narcotics in the way that they've been prescribed by your doctor for the treatment of chronic pain is associated with a very low risk of becoming addicted to these narcotics. So I thought I'd just highlight some important definitions as it pertains to this situation. Drug tolerance occurs after prolonged exposure to a drug, and it occurs when the effects of that drug results in progressive decreases in its effectiveness. It's a normal physiological phenomena where the body simply requires more drug to achieve the same level of pain control. It's not considered addiction, and true tolerance is actually rare and does not occasionally occur. Drug dependence is also a normal physiological response to the effects of chronic narcotic administration, and it is only seen when the administration of a narcotic is abruptly stopped or is rapidly reduced. And the removal of the narcotic causes withdrawal syndromes such as nausea, muscle cramps, and diarrhea. And this as well is not a sign of addiction. True drug addiction is a psychological dependence where there is a compulsion to take a specific drug to experience psychotropic effects. Addiction is associated with a craving for the abused drug and continued compulsive use of that drug despite harm to the person using the medication. Now, even though we are all individuals and we experience pain to different extents and severity, there are only a set number of pain medications on the market. So physicians are limited by what they can prescribe and are often forced to match a patient to a certain manufactured medication. But in healthcare, one size does not fit all. And one of the most exciting new concepts in pain management is the use of customized, individualized transdermal medications that can be made in the pharmacy. Transdermal means that the medication is applied and absorbed through the layers of the skin, and it allows for a convenient, non-invasive way to manage different types of chronic pain. And it allows for the prescription to match the patient and their specific needs and requirements. And it also has advantages over traditional oral therapy. Now, your skin is the largest organ on your body, and as such, it has the ability to absorb whatever is applied to it. Now, because transdermal customized medications are applied to the skin, we are avoiding metabolism by the liver. Because the drugs aren't being absorbed through the GI tract or through the stomach, we're avoiding a lot of bothersome side effects such as nausea and vomiting. We're also minimizing the side effects of narcotics such as sedation and constipation. We're minimizing systemic absorption because the medication is being applied directly to the site of pain. We're reducing the drug interactions that could result from taking oral medications. We're also improving patient compliance since patients can use the medications without fear of experiencing side effects while at work or at home. The customized formulations also allow for non-addictive formulations, so this can prevent drug abuse or drug diversion. And most importantly, the transdermal creams can be customized to suit the patient. And because transdermal creams can be customized, the physicians can combine several medications into one cream. So instead of a chronic pain sufferer taking different medications as an anti-inflammatory and a narcotic and a muscle relaxant, all of these chemicals can be combined into one medication, which is then applied to the skin. So we are targeting numerous pain receptors at once, and studies suggest that synergy exists among the drugs with different actions, which can be used to amplify the benefits and the results of these medications. As we come to the end of the presentation, I just want to talk a little bit about what employers and employees can do together to cope with chronic pain in the workplace. For employees, it's recommended to connect with your boss and to other coworkers. So you don't have to reveal the details of your health condition, but it's important to let your boss know about your chronic pain so adjustments and accommodations can be made. Chronic pain can be difficult to understand, so it might be a useful exercise to educate coworkers and employers about your pain and how it affects your ability to work. You can also seek accommodations at work. So help can come in many forms, from changing a workstation to changing hours of the job or working remotely from home. It's also recommended to stay in the loop. So if pain forces you to stay home for long periods of time, remind your boss and remind your coworkers that you're still part of the team by checking in on work while you're off. And if you can, attend work seminars or important meetings. It's also recommended to keep a pain diary. So write down the details such as when pain attacks occur and what helps to ease them. And this can also be used to come up with accommodations at work. And it's also recommended for the patient or the employee to seek out proper pain relief therapy, either through the traditional oral forms or through the unique customized formulations we talked about today. For employers, be accommodating. So beyond meeting your legal obligations, accommodating a worker's health needs also allows you to retain a valued employee. And also be your employee's advocate. But by showing you understand and support a worker suffering from chronic pain, you'll be preventing negative talk within the workplace and also encouraging other employees to be supportive, which results in a positive culture. And finally, it's important and mindful to remember that chronic pain is no different from any other type of chronic conditions, such as high blood pressure or diabetes. So just as someone with diabetes needs to take medication, often long-term and for the rest of their life, medication therapy for chronic pain can also be needed long-term. And chronic pain may be pervasive, but it doesn't have to take over your career or your business. Having ergonomic stations will help employees who need to sit or stand for an extended period of time. And sitting too long can lead to pain in the back and shoulders and neck. And standing can result in pain of the back or the legs. So having stations which facilitate proper movement and decrease repetitive motion tasks can be very effective to prevent chronic pain. Also, employers should endorse regular breaks, and this is good to have employees stretch, to move around, and get some fresh air. And finally, having wellness programs in the workplace is a great way to keep employees fit and pain-free. If there are any questions regarding the presentation, or if there's further questions on items or issues that I didn't talk about today, I've included my phone number and email, and I would be more than happy to talk to people if they have issues regarding the presentation today. And I'll send it over to Tanya.
Thank you, Brent. And as an appreciation for your time and expertise, the Chamber will be making a donation in your name to our scholarship fund. I would also, again, like to thank and acknowledge the University of Fredericton for sponsoring our Lunch and Learn webinar series. If you would like to watch this webinar again, or you would like to pass it along to any of your coworkers, it will be posted on the Chamber's website and our YouTube channel within the next few weeks. All right, thank you, and have a great day, and make sure you get out there and enjoy the sunshine because it is beautiful today. Thank you.